You think I'd be better at it, but I'm not the best at it. But how do you deal with upset people? I mean, I see them a lot. Seems to happen more frequently in the hospital than in clinic, apparently, which is why clinic is better than the hospital, according to some docs. But yeah, how do you handle upset people? Most often, I would say in the hospital, they're not upset with me, but it sort of matters and doesn't matter because I still have to deal with it. They think, yo, you're the doctor, you're in charge. You're like, yeah, that's not true. I really have little control over most other people in the hospital. I can put in a request, doesn't mean much. They may or may not get done. But the real question is, how do you deal with it? And it's very interesting because this morning I was talking to a patient who was quite upset, and I thought just listening, empathizing, saying, yeah, pretty helpful. And then one family was like, no, 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 just leave. There's no point just letting her keep on going, just works herself up. Like, that's very interesting. Yeah. So I feel that's one thing that's sort of very related to the idea of sort of controlling yourself, right? Some people get worked up and then it just blows off steam and it's gone. You see it quite commonly in TV shows, right? There's some characters who blow up and they're off. They're done. It's out of their system. And some people in real life are like that, which is actually not a bad thing, right? They get it over with. They get out of their system. But for many other people, it's just smolders there. They can't get relief. Just smolders. They may become bitter people. How do I deal with it personally when I get upset, right? I mean, sometimes you call customer service, you complain, and then you get out of your system. But the reality is, I guess customer depends on where they're based. Oftentimes, they're based outside the U.S. You can't even communicate. They don't really get what you're saying. They try to say things to placate you. They're not making any things better. Blah blah blah. It doesn't make things better. With the U.S. is hit or miss because sometimes they're not helpful. They're actually a jerk, which I guess because they're not overseas based, they don't worry about performance or satisfaction scores as much. But some of them are helpful, and I thank them for listening. Got out of my system. They apologize. Nothing they could have done. They're not physically there. They're not related to this incident, and it's done. But the thing is, what if you can't get relief, right? Is it possible to put it off? Okay, I have other stuff to do. I can't focus on why I'm upset at this person. Let's just deal with it later. Can that be possible? Or is it just going to stew and stew and stew and eventually it'll explode? And you can't focus on other stuff because you just have to get this over with. And I think that brings to mind the concept of compulsions versus impulsive. So, an impulse, something somebody does without thinking. Compulsion, something you feel the need to do, and it just itches and nags at you until you actually do it. Like an itch. It's a compulsion. You got to scratch it. If you don't, you can't do anything else basically until you scratch it. But then even if you fake scratch it, like you have a cast on, it feels better. Compulsion. Impulse. Buys. Impulse buys. People just buy stuff, not thinking. Most commonly you see it in the grocery store checkout aisle. Oh, that looks cool. I could use one of these. There you go, $5, $10. I guess stuff has gotten more expensive in those checkout aisles nowadays. Some places like Ross or those discounters, a whole grocery line, or not line, checkout line is full of these impulse buys. But going back, how do you deal with people? Let them talk it off? I mean, a family member made a good point, and I think that I have to think about this and rethink how I do stuff. Just letting someone go off to forever if they're not going to ever finish is not actually a positive thing, right? Sometimes they just need to be cut off, redirected, told this is not helping, right? I mean, it's not the same, but I usually do this with my patients who are coming here with something missed by a prior doctor, oftentimes cancer. They're like, oh, really upset. I was like, you definitely could sue the other doctor, but look, You only have a few months left to live. Would you rather spend your time suing the doctor, even if you win? What are you going to do with your money now that you're dying and you can't do anything physically? Don't you would rather? Wouldn't you rather just enjoy the rest of your time, put it out of your mind? You can't go back in time. You can't. I can't. Nobody can. Right? Because really, it's not about. Some people may say, "Oh, it's about other people." No, it's not. It's about you. That's the truth. You're not helping other people. You're helping you, and you'd help you more if you just forget about it and let water in the bridge be water in the bridge. I guess many other times there's things that people are said out that when they feel slighted, offended, and you can't fix that. You can't fix a feeling of being slighted or offended. It's going to color how this person views other people in the future and their actions. So maybe it's best just to cut it off, redirect. Don't indulge them. In fact, that's the funny thing. All the AI, chat, GPT, and all that stuff, they're now being rerouted or rewritten or whatever term you want to use for these things that are intelligent but not really, right? The sub programs. Because apparently people are saying that you shouldn't encourage people who have delusions. You should actually cut them off and saying that's incorrect. You shouldn't be encouraging their psychotic tendencies, which makes a lot of sense to me. And that's what they're actually doing now. So maybe I should learn a thing or two from what they're doing, from what the family member said. Setting time limits. If I do it for my 2-year-old and it's good for her, why don't we do it for everybody who's throwing a tantrum?